I'm Dr. Rolling Gleason Barfoot, and chiropractor at Santa Fe Chiropractic Center. We have been doing the chiropractic care in this area since 1982. I have two colleagues that work with me, Dr. Barbara Brown and Dr. Jerry Vitek.
I'm Dr. Jerry Vitek. I've been practicing chiropractic since 1991. I've been involved with Santa Fe Chiropractic since 1998. I'm a lifelong resident of Santa Fe, and in addition to chiropractic, I enjoy specializing more rehab and impairment and disability ratings.
Hi, I'm Dr. Barbara Brown. I'm one of the chiropractors here at Santa Fe Chiropractic Center. I'm also a certified acupuncturist, and I've been here since 2011. We've got some patients that utilize just acupuncture, some that do chiropractic, and some that do both. They seem to work really well together. So we've got a patient here that's got some low back pain. She's had it for quite a while, so we're going to do a low back acupuncture protocol on her, and we're just going to take it from the very beginning, and then we'll let the needles stay in, and then we'll take the needles out, and you guys can see how she feels afterwards. So what we're going to do first is we're going to, I've already washed my hands to make sure we don't have any contaminants. We're going to clean off every site that I'm going to put a needle with alcohol, kind of remove any surface bacteria that we don't have any problems. Okay. We're going to do some points in her low back. We're also going to do some points in her legs. We find that the points that are a little bit further away from the pain seem to work a little bit better. Helps just kind of bring the energy up to the area where we've got a problem. So the needles are really small. They're about the size of a human hair. They're sterile. We use them once, then we throw them away. So we don't have to worry about anybody getting infected with anything. Needles are tiny. Probably can't even see them. Okay. They're not filled with anything. They're stainless steel. So what you see in this hand is a guide tube. It's plastic. It's just a hollow tube. What we do is we stick the needle in the side of the tube. Then we push the needle down on the skin where we want to put the needle in. What that does is it desensitizes the area, and then we just tap the needle in. For the most part, it's pain-free. If there is any discomfort, it only lasts a couple of seconds. Most people find this really relaxing. They come here for their stress relief. Okay, so we've done points on her low back. Now we're going to move down to the legs. Any discomfort? Okay, perfect. So I do more of a Japanese style of acupuncture. It's a little less painful. It's a shallow needle insertion. Like I said before, the needles stay in about 20-25 minutes. And just depending on the condition that we're treating depends on where we put the needles. Okay, so I use anywhere between 20 to 50 needles, just depending on the patient and what we're treating. We treat shoulders, we treat knees, we treat low back, we treat necks, we treat headaches. Just, if you can imagine it, acupuncture will help. So we're going to let her relax for a few minutes, and we'll come back in a minute.
All right, thank you.
I'm Dr. Jerry Vitek, and I'm here to just demonstrate one of the many exercises we do for lumbar rehabilitation. Julie, if I can just have you just do the one procedure we talked about. Just go ahead and look, and let's go ahead and lean to the right for me. And come back for me. Go ahead and lean to the right. And back. Keep it in form. Back. And forth. Okay, that's good. This is good for strengthening the musculature. A lot of times we do use a lot of passive modalities, but in order to really recover fully, you need to do like a home exercise program and or some kind of rehabilitation. It's real important for the patient to understand that this is a team effort. We can't do everything. So that's, as long as, the more you do your exercise and rehabilitation, the faster you're going to progress and the less you'll have to see us.
We are located at 12122 Highway 6 in Santa Fe, and we are accepting new patients at this time. You may call 409-925-1803 to make an appointment, or we do welcome walk-ins. So for your alternative care needs for neck, back pain, or headaches, give us a call.